Tonight on Crossfire, is President Obama doing enough to clean up the scandal over veterans' care?
If these allegations prove to be true, it is dishonorable, it is disgraceful, and I will not tolerate it, period.
So why wasn't VA Secretary Eric Shinseki fired?
Mr. President, we need urgency. We need you to roll up our sleeves and get into these hospitals.
On the left, Van Jones. On the right, Newt Gingrich. In the Crossfire, Senator Bernie Sanders, a Vermont independent, and Senator Dean Heller, a Nevada Republican. They risked their lives for our country. How does the president do right by our veterans? Tonight on Crossfire.
Welcome to Crossfire. I'm Van Jones on the left.
I'm Newt Gingrich on the right. In the Crossfire tonight, two members of the Senate Veterans Committee. Two sad stories emerged from President Obama's embarrassing news conference today. The first is that after having a 5-year opportunity to clean up the Department of Veterans Affairs, both he and his cabinet appointee failed. Second, faced with universal coverage of that failure, all we got from the president today was this.
All of us, whether here in Washington or all across the country, have to stay focused on the larger mission, which is upholding our sacred trust to all of our veterans, bringing the VA system into the 21st century, which is not an easy task.
Bill Clinton used to say, "I feel your pain." Barack Obama says, "I hope you'll feel my pain." This is a big mess. It deserves a big response. Instead, we get another pathetic example of this president not being up to the task. After Syria, after Ukraine, we have a new red line. This time, it's around the Veterans Affairs building.
Look, I just think that's completely unfair. First of all, he's doing the investigation. There has been real progress. The homeless issue's been dealt with. Look, we can get into this. Look, in the Crossfire tonight, we've got Senator Bernie Sanders. He is a Vermont independent. He's also the chairman of the Veteran Affairs Committee in the Senate. We also have Republican Senator Dean Heller of Nevada, who also serves on that committee. Welcome to both of you. Let's start with you. You got a big, you've been in the spotlight on this thing. You got a lot of attention last week. You actually asked Shinseki to his face why he hadn't resigned. Let me ask you a question. Do you think if you were the President of the United States, you would have fired him today? The investigation's not finished. Would you have fired him today?
I would have taken a good look. I agree with the Speaker on his comments and his introductions. I think this is a real lack of leadership as we're moving forward on this particular issue. And there are a lot of stories out there. We've known about this for 5 years. Well, this isn't a new issue. Senator Obama, when he was running for president, said he was going to clean this up. We got a 1940s system in the 21st century. We're no closer to cleaning this problem up.
Well, I don't think. First of all, let me begin by thanking Dean. Right?
Thank you.
We talk about veterans issues. I introduced with my committee in a very bipartisan way. We try to make it bipartisan. The most comprehensive veterans legislation introduced in the last 20 years. It was supported by the American Legion, the VFW, the DAV, all of the veterans organizations. Brought it to the floor. I want to thank Dean very much. There were 2 Republicans who supported it. Dean Heller was one, and Senator Moran of Kansas was the other. And we only got 56 votes. We need 60 to overcome a Republican filibuster. And we're going to move forward on that, but I do want to thank Dean for his support of that important legislation. Now, let's talk about the VA for a second. Does anyone here think the VA is perfect? I don't think so. But if you look at the VA objectively and fairly, Newt, what you find out is, number one, according to the veterans themselves, who do these patient satisfaction surveys, they think VA healthcare is pretty good. Dean, let me finish. Dean was at the hearing with me.
I was.
And we asked all the veterans organizations, and we said, once you access VA healthcare, is the care good? And what they said is it was good to excellent. The problem that we're dealing with, which is a serious problem, is waiting lists, is access.
Well, 2 things. I mean, first of all, among younger veterans, Iraq veterans and Afghanistan victims, I think 59% say it's bad to poor. Only 38% say that it's excellent or good. So there's a big difference generationally. Second, you've had cases now where you have people who couldn't get a colonoscopy, which is one. I mean, they're in the system, so it's not a problem about getting registered. They died.
Yes.
Isn't there something to be worried about there?
Worry about it? It's a tragedy. It's a tragedy. Who could argue that? People have died because of bad care within the VA. But Newt, This is a Scientific American article of a year ago. You know what it says? In hospitals in America, not the VA, in hospitals in America, you've seen that study, between 200 and 400,000 Americans die because of poor treatment in hospitals. They die of infections, of getting wrong dosages of drugs. So we have a healthcare crisis in America.
In general, but let me go a step further. You mean you met today with the president's chief of staff?
Yeah.
Did he say anything that was more reassuring than the president's press conference?
He said that he and the president regard these problems very, very serious, and they're going to do everything they can to get to the root of them. But let's talk about what the problems are. As you know, Newt, in recent years, because of the wars in Iraq and Afghanistan, and you're looking at a guy who voted against the war in Iraq, but as a result of those wars, we have seen a huge increase in the number of people coming into the VA. Right. So these are some questions that we have to ask.
And that's really where these wars, by the way, which the Republicans were big cheerleaders for, got us into. I hear no accountability, responsibility from Republicans about flooding the system that we've got. And then all day long, we hear smashing on the president. The president's horrible. What could the president have done today that would have satisfied you? He's got an investigation going on, number one. He said he's open to firing Shinseki after an investigation. Our president happens to believe in maybe having an investigation before an execution. What could he have done today that would have made a difference for you Republicans?
Well, I wish what he would have done a month ago when this thing came to the forefront. It took 2,000 articles in the newspapers on TV telling him to be upset. And so today he manufactured some ire.
Oh, that's completely unfair, Senator.
Look, true.
What could he have done today? Today, he stood by the investigation. He opened the door for a resignation or a firing of Shinseki, and he's moving forward. Do you just want him to come in there with the guy's head on a pike? What could he have done today that would have made a difference for Republicans?
Work closer with members of Congress, even on the piece of legislation that the chairman, that I supported him on. I don't think the president was engaged like he should have been on a piece of legislation of that caliber and of that importance. He could have been out there in the forefront 3 months ago, 6 months ago, and really fought for the veterans.
This is a bipartisan problem that's been going on for a long time.
I agree with that, by the way.
You were willing to work with this senator to get something done about it.
That's
Where are
right.
the rest of the Republicans to get something positive done?
By the way, this is not a money issue, and I think we're trying to turn this into a money. This is a management issue, not a money issue. We've increased 60% the amount of money that we've put into the VA system in the last 5 years.
Well, you double the wars.
Hold on. When you have 2 wars and a lot of folks are coming into the VA, obviously you are going to spend more money. I don't know. I'm not so sure that you're right on that, Dean. I think you got 2 issues. Number one, I think it is a fair criticism of the VA to say, is their management as effective as possible? Do you have bad managers in hospitals who should have been fired? Probably. You need investigations? Probably. Second of all, though, I think that when you see a huge increase, we got 1.5 million more people in the VA than we had 3 or 4 years ago. You know what? You may need more staff, and it may be a money issue as well.
Well, let me ask you 2 questions about that, though. Okay, first of all, the House today, on a bipartisan basis, overwhelmingly passed a bill that would give the secretary the ability to fire about the top 450 people in the VA as a way of starting to get to what you just talked about.
It's a good step.
Would you be willing to bring that bill up in the Senate, get it to the president, and give them a chance next week to give Shinseki that kind of authority?
We are going to take a hard look at that bill, and we are going to do a hearing on that bill. You don't just bring a bill up, as you well know. And I think we're going to look at a number of pieces of legislation. But if the issue is, should the secretary be able to get rid of incompetent leadership? Absolutely, positively.
Second, I was struck when we began doing research, and I've done 3 articles now at CNN.com on the current situation. The VA today is 50% bigger in personnel than the Marine Corps.
But that doesn't. So what does that mean?
Well, I mean,
they're taking care of 6.5 million people.
First of all, it is a huge system.
It is a huge system.
And it's a system whose information technology is at least 15 to 20 years out of date. Now, this is partly the Congress's fault. Now, this is not a Shinseki problem. All the things that Obama campaigned on in 2008 were true, and they're still true. What's worrisome to me on a bipartisan basis is this really requires a systems reform that cuts through the whole thing. This is more than scapegoating General Shinseki. This is also the Congress has to own up to having helped create part of this mess.
We have a bureaucracy problem in the VA. And we have managers now that are not afraid of Shinseki, and they're not afraid of President Obama. They're simply not afraid of him. I can give you a good example in the state of Nevada where we have a regional officer, the director, that won't return my phone calls or anybody else in our delegation. That's a problem.
Let me give you a better example. Let me give you a better example.
When we come back, now we're hearing a lot of outrage today about the VA as well. We should. But in a minute, I'm going to ask you, Senator Heller, However, the Republican outrage on this seems a little bit selective. But first, today's Fireback quiz. How far back does the VA actually trace its roots? Is it 1636, 1776, or 1917? We're going to have the surprising answer when we get back.